And the other thing I want to tell you is that the immune system is always watching what's happening in our body. Our immune system, my immune system knows what belongs to me. And that's why if I put my brother's skin on my skin, it will immediately be rejected, even though we are from the same parent, partly because my immune architecture is a bit different than anybody else's. Identical twins, they're more closer to than anybody else. But it is the immune system knows what belongs to you, what doesn't belong to you. So when these normal tissues suddenly get into these cancer situations where they produce abnormal proteins, the immune system is looking for these abnormal proteins and probably they eliminate most of them. And in fact, people say, scientists would talk about this, they all make some baby cancer cells, but they get eliminated by the immune system because they're always looking for these abnormal cells. But now and then what happens is that the immune cells either don't function as well or they get exhausted because they come in, they try to kill these cells and they keep doing it. The cancer cells are stubborn and they just constantly telling the cancer cells to go away and try to kill them and they get exhausted. And then over time, the cancer cells can get an upper hand. One of the ways they get an upper hand is the tumor cells can produce a protein that I'm sure you're familiar with called PDL1. And that in turn makes the T cells exhausted. So they just come there, they're worn out, and they don't do, the immune cells get worn out and they don't do the job. And that's the reason these cancer cells can grow faster. PDL1 is not the only protein the cancer cells can produce to dodge the immune system. They find various ways to avoid the immune system's watchful eyes. And one thing we have really studied well is the PDL1 protein, the other protein called CTLA4 that we use for melanoma, not so much for lung cancer. Lung cancer, we use quite a bit on the PDL1, PD1 directed proteins. And so that's why in the right patient, if you give the PD1 or PDL1 inhibitor, what happens is that the T cells get rejuvenated or the immune cells get rejuvenated and they kill the cells. So what normally happens here, the tumor cells are not eliminated, the immune cells get exhausted because of the PDL1 activation. But when you do the reverse, when you inhibit the PDL1 or PD1, you can eliminate the cancer cells. That's why in some very lucky patients, you can eliminate these cancers, and some of them go on to live many, many years. And in some instances, even in stage 4 lung cancer, we cure them. Of course, we cure a lot of patients stage 1 to 3 lung cancer with immune therapy these days, and this is how this works. So there is a constant interplay between the altered genes in the tumor cells and the immune system, and that is how the cancer cells are regulated, and that's how the cancer cells are eliminated, and that's what we're using to come up with new therapies and eliminate them. So I gave you two examples. Gene alterations lead to cancer. Now we can target the gene specifically by going after specific drugs. Second, these altered tumor cells are eliminated by the cancer cells, by the immune system, but the cancer cells can dodge the immune system by producing these abnormal proteins. We go after them to eliminate the cancer. So that's how we really come up with these approaches and strategies. And a lot of this work was driven by many investigators around the world. A significant amount of the work was also done by my colleague Bob Schreiber from Washington University.